Waiting for it to load. Okay, we're going to get started now. Thank you all for joining this town hall discussion with Congressman Denny Heck and Dr. Geoff Baird. Congressman Heck represents Washington's 10th district in Congress, and Dr. Baird is the interim chair of the University of Washington Department of Laboratory Medicine. So today we will be discussing the impact of COVID-19 here in the South Sound. We'll be asking questions that constituents have sent in either directly to our office or through social media. And we will try to be working in some of the questions posted in the comments section of this Facebook Live feed during the town hall. But before we get to questions, I will turn it over to Congressman Heck and then Dr. Baird for opening remarks. Congressman.
Thank you. That's Bobby, our moderator. Thank you, Bobby. And thank you all for joining us for discussion of what undoubtedly is the most important challenge and issue facing us as everyday Americans and this country as a whole. As Bobby indicated, I will make a few opening remarks about where we are and my perspective on this, and then turn it over to Dr. Baird for his opening remarks. We're real fortunate to have him. Bobby introduced him as the head of the virology lab. He is basically the #1 testing expert in the state at this point, and we're really very fortunate and grateful that he would spend his time with us. Obviously, we are experiencing something that no matter how old we are, most of us have never experienced in our lifetime. This is a dual challenge on an epic scale. The first is the public health challenge. As of this morning, there had been more than 1,100 deaths in Washington, or in the country, in Washington State. This count goes up so fast that I literally check in with my staff on a daily basis. It's 1,100 nationwide. And that's a public health challenge, first and foremost, and what it obviously implies a great deal of human suffering. Secondly, because of it and because of our necessary response to it, we have an economic challenge on a scale that we haven't experienced probably since the Great Depression. The magnitude of this was brought home with the release of the jobless report today, the number of people who applied last week for unemployment. To put that in perspective, nationally, 3.3 million nearly people applied for unemployment, and that was more than 4 times the previous record, which was set 40 years ago. So it is of significance. There are going to be a lot of people out of work, and Congress has tried to respond to this through the enactment of 2 and soon to be 3 bills. The first bill was an $8.3 billion infusion of money into the public health system. The #1 thing we can do to allay human suffering and, in fact, to mitigate the economic magnitude is to stop this virus in its tracks as best as we can. And so that was the primary purpose of the first bill. The second bill dealt with a lot of the issues that people face on an individual basis, paid sick leave, family leave, so that they know that they would not be any more damaged by this than is possible as they seek to cope with it. And then the big bill, the one that passed the Senate last night and that we will vote on in the House in all likelihood tomorrow. And oh, by the way, I am at my home in Olympia now, but I'll be on the red eye tonight, leaving at 11:40 p.m. to go back for the vote tomorrow, is a $2.2 trillion effort to continue our effort to mitigate the impact on individual lives. It has a couple of features in it which I felt very strongly about and advocated very hard for. The first of which was a significant increase and extension of unemployment compensation. We are going to hit unemployment levels of double digits and maybe quite a bit higher. And the best thing that we can do is to ensure that people can continue to pay their bills. It also has the twin benefit of getting those dollars circulating into the economy so that it doesn't spiral down any farther than it might otherwise. The second thing that I strongly advocated for was significant assistance to small businesses, who are, of course, the start and the employer of most employees in this country. And so we enacted a $350 billion small business assistance program, forgivable loans for those companies, those small businesses that retain their employees. And I thought that that was really significant thing to do. The other thing, of course, as with all these bills, it included additional money for the public health effort. For example, there's $100 billion in there to help hospitals who are just getting slammed by this. So those were the three things that I wanted to point out specifically before we get to your questions. I also want you to know that this was the third bill, and there'll likely be a fourth, and there may be a fifth, as we correct the errors of the previous one and recalibrate and see where it is that we need to spend our money. Now, let me just conclude by saying this. We're in the soup. We are in the soup, but we are all in it together. And we will be best served if we remember that. And we remember that the best way for us to get through this is with determination and compassion for our neighbors. Check up on them, please, especially if they're elderly or are compromised health-wise in any way. And as long as we remember that it is important in this time, when it would be so easy to submit ourselves and give in to fears, instead answer the calls for our better angels. Because the truth of the matter is this country has been through an incredible amount in the last 100+ years. World War I, Spanish influenza, Great Depression, World War II, and right on through today. We'll get through this again too, together. And with that, Bobby, if you'd introduce Dr. Baird.
And we have Dr. Baird, if you have opening remarks.
Thank you, Bobby, and thank you very much, Congressman Heck, for inviting me to participate in this town hall. Just to explain a little bit of my perspective, so I am a clinical pathologist, meaning that I run the hospital laboratory. A lot of people have had hospital laboratory tests, but maybe not thought about them as seriously as people are thinking about them in the last couple weeks. So my job at the University of Washington Department of Laboratory Medicine is to support approximately 50 doctors, 55 doctors, and about 1,000 staff, meaning lab techs, scientists, support staff who do for that system. And since about March 1, we have spent an enormous amount of energy ramping up our clinical testing for COVID-19. To preempt a few questions that I'm sure folks might have is, one is people are going to ask, where's all the testing been? I want to point out that for someone with my experience, being trained to do laboratory testing or being trained as a doctor, this isn't just a once in a career or even a once in a lifetime event for the medical system. This is a once in many, many careers event. What is happening now hasn't really happened on this scale, from what my reading and training has been since World War I. My grandfather was 4 years old when that happened. So there aren't probably any people around except for the oldest person on earth who might remember the last time there was a global pandemic of this scale. So that's one thing to keep in mind, is that we're really having to adapt to the situation that while we have all studied and we're all, I think, prepared for mentally, we really do need to be very innovative in the way that we're doing this, because this is new. The second thing I wanted to talk about is just what is the role of laboratory testing at all? I'm a laboratory doctor. I have general medical training also, but this is one of the few types of global crises where laboratory testing is actually at the forefront. We do not currently have a vaccine for COVID-19. We have several promising medications that may in fact help modify the disease or perhaps cure it, but we don't actually know any of that right now. We need to do study, and so there isn't really any reason to go out there and take any one medication because we don't have evidence that they work. What we can do now is do the social distancing recommendations that our CDC and our public health colleagues are telling us. If someone does get sick, perform supportive care. So that would mean the normal things we do when someone has a respiratory illness, but then also do laboratory testing. And the reason that laboratory testing is helpful is there are actually many reasons. First and foremost being, we can track what's happening. Without a laboratory test diagnosis, we don't actually know if someone has this disorder. This COVID epidemic happened to occur right about at the peak of flu season. So, for example, the University of Washington's Department of Laboratory Medicine Virology Laboratory has performed about 25,000 tests so far, maybe a little bit more. We do a lot each day. And we found about 2,000 positive cases. So if you do the math, on average, we've had about 8% positive of people who, had symptoms and were worrisome and we worried about them. And only about 8%. It's gone up to about 10% in the last couple of days. But that still means 9 out of 10 people that we've tested in our state have not actually had it. And so it's important for us to know how to approach a patient if they have it or not. The second reason that we need to do laboratory testing is we need to protect our frontline first responders and our healthcare workers so that they can continue to take care of patients, both COVID-19 patients and all the patients who have all of the other diseases that I need to say are still happening, even in the midst of an outbreak. And I'm spending most of my days dealing with just COVID-19 problems. People still do get and have cancer, other infectious diseases. They have drug overdoses, they have trauma, all of those things still happen, and we need to take care of them. So that's another reason why we have to do that laboratory testing, is to identify who has this, and then how can we best use our protective equipment, gloves and masks and eye shields, respirators, those sorts of things, to protect ourselves so that we in the medical community don't either get sick and be unable to take care of patients, or transmit that disease to other patients who may not have it. Last thing I'll say before just opening up to questions is that part about testing as a sort of epidemiology or public health maneuver is going to be a very essential part of what we've called flattening the curve. You may have seen this in the newspaper or online, seen the picture of a really steep spike of cases. But if we really do these social distancing maneuvers, we respect each other's, respect the calls for not gathering in groups, et cetera, we may be able to, and we should be able to, have a lower rate of cases that happen, and that will make all the difference in the world to our medical system to be able to take care of people. If we end up having 20 cases a day that come to the hospital, that's one thing. But if we have 400 cases come even for a few weeks, we will not be able to take care of all the other people who have all the other things that happen in hospitals. So we really do need to use laboratory testing and epidemiology and our social distancing and all the recommendations from public health and the CDC. So with that, I think I'll turn it back over to the congressman to start the question part.
Thank you, Dr. Baird. That was extremely informative, especially now, fascinating now that we're all living through it. Our first question going on that is about testing, and it comes from Twitter. Hello, I keep hearing there are thousands of COVID-19 tests being produced in Washington State, and also the tests aren't available to the public. What is or what will be the process to get tested?
So I'm going to defer some of that, obviously, to Dr. Baird, since we do have the foremost expert on testing in the state with us this evening. I will just say that I am confident that the broad-based availability of testing will be conducted. It is ramping up on a daily basis for people where appropriate. But I will also bluntly tell you that I don't think we rolled this out very well. I give thanks that we have the UW lab that stood up its capacity to do this, but on a national basis, I think we were way too slow and way too inefficient about getting it out and using testing as a powerful tool to help us contain this and flatten that curve, as Dr. Baird says. There's a lot of frustration on the part of a lot of people about it and a lot of questions, and I understand that. We had, for example, a federally designated testing site drive-through testing site at the Tacoma Dome that just closed today. It was open, I think, for 5 days. And they promised us equipment and personnel to staff it when they said that they would provide it to us, but they ended up not having the staff, so the local community had to pay for it. They did provide the equipment. And then they insisted that those swabs be sent back to the private commercial lab, and the turnaround time on that was 5 to 8 days, when at that very time, Dr. Baird had capacity and could have let patients know within 48 hours, in fact, closer to 24 hours. So we're working through the Federal Emergency Management Agency on these things and jawboning them as strongly as we can to make sure that tests are available where people need them, and make sure that the test results get back in a timely fashion. We did include in the legislation that testing would be free for people. Nobody should not get a test because they fear that they will have to pay for it. We need to know if somebody, in fact, has this disease. Dr. Baird.
Thanks very much. I think that everything you said was spot on. So I can just add the perspective of what it looked like to the medical community for this. And some of I won't dwell too much on the reasons why we got here, because really the important thing is how are we going to get more testing available moving forward. But what I would say is, yes, thank you very much for your votes of confidence of me as a great expert in this. But I have heads of my virology lab who are the true subject matter experts who know everything about viruses. And in fact, my associate head of my virology lab, Dr. Alex Greninger, he made our test in January. That's one of the reasons why we had a head start. We were all ready to go when we were finally allowed to, by the federal government, regulatory wise, begin testing. And so we started pretty much the day that we were allowed to do that, and have been doing it ever since and growing. I'll also point out that in the first 2 weeks of ramping from, say, March 1st to 14th, I had to spend about $10 million of my department's reserves doing this. It's an absolutely enormous amount of money, and it continues unabated, where we have to buy multiple different testing systems and all. And so you did mention the commercial testing laboratories. The commercial testing laboratories are actually going to have to be a large part of this, because I don't actually have the capacity to do all the tests in the country. No one does. You know, no one can do 350 million tests in a day. That's the approximate population. And so our partners in the commercial laboratories do have large operations where they can scale a bit more rapidly, but it's actually a global problem. I use the same supplies that the commercial testing laboratories do too, and until all the companies that make these supplies can increase their capacity to make things more, if I get a test, then that means the commercial laboratory doesn't have a test, and if they have one, that means I don't have one. So we've really had to be very creative. And so getting at the answer to the question that was asked on Twitter, why aren't we doing that? This is because we don't have enough tests. We have on the order of a couple thousand tests a day to do, and we are focusing, as we always do in the medical community, when we have a scarce resource, we apply those to the sickest patients who stand to benefit the most. And so right now, meaning we at the University of Washington Laboratory, have enough capacity to care for hospitalized patients in the region and the state, but we do not have enough to test for, say, asymptomatic patients or worried patients. Now, eventually, in a perfect world, which this is not, we would actually be testing lots and lots of patients to really get an idea of everywhere where this is, all the asymptomatic patients, all the mildly symptomatic patients, so that we could trace their contacts and advise those patients, you may not feel it right now, but you do have this. You should limit your contact, or you're negative, and that may be not the case. But we just don't have the capacity to do that right now. So what has happened is that there are folks in our community who have seen, yes, there's a multiple day turnaround time, or for sometimes at the commercial laboratories, they have, been many, many days without results that have been sent back. And that's because they may have in the low tens of thousands of tests a day capacity, they may be receiving hundreds of thousands of samples, and the math just doesn't work out that you can do, if you can do 20,000 tests a day and you have 10,000 on your doorstep, the math doesn't work out that you can do it instantaneously. So we're doing the best we can, And the reason that we're focusing on keeping our turnaround time fast, as opposed to just allowing a 10,000 or 100,000 specimen backlog to accrue here, is because to be able to make the decisions we need to make in inpatients, meaning hospitalized patients, we need to be able to make those decisions in less than 12 hours. And so we're focusing all of our energies on that so that the sickest of the patients get that test quickly so that we can make a medical decision as to how they need to be treated. And also, a very closely related topic is our personal protective equipment. That's I'll say PPE. That's what we use, the word we use in the medical field. PPE is very, it's very, very critical. We need to use that to protect ourselves as healthcare workers from the patients, and also protect the next patient from us carrying virus to the next patient if it's there. And we don't need to use as much PPE if the patient is negative, but we need to use a lot of PPE if the patient is positive. And if we have a 24, 36, or 48 hour or 3 to 7 day turnaround time, that means we may need to use a lot of PPE for even, as I said, the 90% of patients who are negative. And that's a big waste, and we're running out of PPE. So to take care of your family, potentially you, your loved ones, and your community in the hospital effectively, we need to focus that testing on the hospitals themselves so that we can maintain our readiness and take care of those who really need the most care. It's incredibly unsatisfying, I know, for folks to sit at home without knowing. And what I will say is my capacity, I expect it to grow 50% or more by next week. And I think everyone else in the community will also be getting more testing capabilities at lower or medium volumes at all the different hospitals across the country in the coming weeks. But we do have a lot of catch up to play. So it's going to be a while before we can really do what we should be doing, which is testing everyone who really does need to be tested. Next question.
Thank you for that. So along those lines of PPE, the next question is, we need enough N95 masks for not only healthcare workers, but citizens. We need adequate ventilators. We need adequate gowns and other protective gear for healthcare and other frontline workers. We need them now. What are you doing to help make this happen? And this one, I imagine, directed toward the congressman.
Thank you, Bobby. Well, the bill that we're going to adopt tomorrow includes, for example, $16 billion with a B appropriation in order to recharge the strategic supply system of personal protective equipment. It's a pretty major investment and commitment, and it follows on some less large investments in the two previous bills. It also has some specific appropriations in it. For example, I think there's $100 million for PPE for first responders, people who are right on the line, as it were, and often come into contact. And of course, there's the 100 billion plus that goes to the healthcare system, much of which will be available specifically for this. But I have to say, from a system standpoint, one of the things that my colleague, Dr. Schreier, has been advocating, she represents one of the adjacent congressional districts to me and happens to be a medical doctor, is advocated for a more centralized allocation according to need. In other words, rather than have everybody just compete on a Darwinian basis, which, by the way, has the net effect of bidding up the cost of things. And we should all remember that there are a lot of people trying to make a fast buck through less than honorable means out there. So if you centralize this so that you can get the PPE, the personal protection equipment, to the places where it's most needed, then I think it would help overall. But we're making a major commitment to it. We have more than weekly meetings with the state emergency management team that includes the Department of Health and the Healthcare Authority and FEMA to talk through these things, where the needs are, what they need us to do as members of the congressional delegation to jawbone the federal agencies to get them to do what they need to do. Lastly, I'll just say that there was $1 billion in the bill that we're going to vote on tomorrow for the Defense Production Act, which was a bill passed during the Korean War that would enable effectively for the president to nationalize certain manufacturing industries to meet the need. And as the president said, we're on a wartime footing here. we've been frankly a little discouraged that it wasn't implemented quicker to get at this.
I have just another a brief add-on from my world about that same question. So we are doing in our hospital settings, just so everyone knows, while we do use a lot of that PPE, that protective equipment, we are using the best science that we know to conserve when we can, and to make really tough decisions about, well, what's the safest thing we can do to minimize what we absolutely need to use, so we're not wasting it. The other thing that I'm very encouraged out is, especially at the University of Washington, we got a lot of smart people here, and I am daily, offered assistance from our engineers who want to 3D print things like swabs. And our national laboratories have contacted me with offers of gigantic, industrial size machines that can sterilize PPE so that we can reuse it. Of course, one of the things that we need to do in medicine and in science is prove that these things work. And because we're facing some of this problem, I've heard the analogy of, it's sort of like you're building an airplane as you're flying it. So, we need to make sure that what we're doing, if we 3D print things or if we sterilize them, that actually works. And so we're going to have to be a bit deliberate to make sure that we're going to be safe and effective when we do those things. But I think folks, especially in this region, should know that really the best minds are on this. And I've been contacted from essentially all of the major companies in town now who want to contribute in some way. So I'm really encouraged on that front. But really, everything the Congressman just said about simply finding the resources to marshal increased production, that's going to be a really big part of this.
Okay, and switching gears now a bit to a big topic. Question is, what is happening in the economy right now?
We're tanking. There's really no gentle way to say it. We are in a recession, although not technically so, if you want to define a recession as 2 consecutive quarters of economic contraction. But there's no question that we're going into a recession. And the only questions really are, how deep will it go and how long will it last? That's why in the main, Congress acted fairly quickly for a bill of this size. 2.2 trillion is a massive spending bill, even for the federal government, and to do it within a matter of weeks, or literally less than 2 weeks since we began negotiating this specific bill, is moving at lightning speed for the federal government. I've had basically 3 principles when it came to what the federal government's response should be. Speed, get it done as quickly as possible to keep the economy from spiraling even deeper and faster. Number 2, be bold. In other words, go big. We can't be adhering to failed economic policies of austerity in the face of this. We should remember that in addition to the tragedy of human health that's occurring, there is economic tragedy here, because the fact of the matter is, if you lose your job or you lose your home, you've been materially damaged. So go big, go bold. And number 3, be as efficient as possible in terms of getting the resources out. Use existing channels. So for example, when I talked about the small business for loan forgiveness program, that's not just going to be through the Small Business Administration satellite offices. They're going to use their partner relationship with over 5,000 banks in order to do that. Banks who do underwrite Small Business Administration loans as well. So be fast, be bold, and be as efficient as possible. Now, having said that, whenever you spend $2.2 trillion, frankly, there are going to be some people who maybe get some money that shouldn't, and some people who don't get some money that should. It's just that massive, and we have to move so fast that there will be some air. But we cannot wait for an air-free environment to respond to this crisis, because the economy is in a nosedive.
Thank you. And Dr. Baird, if you'd like to.
Yeah, I would, I said, I don't want to delve into politics, but otherwise I would just say, in terms of the economy for the medical system, I am, as a department chair, somewhat knowledgeable about what's going on. And I can say that everything that you just said about the economy in general applies to our medical system, and UW Medicine is going to need an awful lot of help to survive this. This has cost an enormous amount of money. It will, the numbers boggle the mind. but this is we may be one of the hardest hit industries in this, simply because we're having to do so much for this. So that's another real important problem that needs to be addressed. And I'm glad actually that I've been talking with Congressman Heck about this too, that he completely understands that's going to be a real problem moving forward. Because again, our problem in the medical system is not simply just countering this epidemic. It's still taking care of people who have all the other things that still happen. So the other diseases didn't just disappear. We have every other thing that we do and that we absolutely need to do, and our community expects us to do. We have to do that still.
Let me tack on to what Dr. Baird just said, because I think it's very important. People are probably aware that all elective surgeries have been canceled. All elective surgeries aren't created equal. The fact of the matter is they may not be a matter of life and death, but they are a matter of consequence. It may be that somebody's peace of mind is fundamentally impacted by the failure to get that surgery. Or it may be something like a friend of mine just told me yesterday. She's had one hip replacement, and in the wake, which did well, but in the wake of that, her other hip failed. It completely failed. She cannot walk now for more than a few steps. She is in excruciating pain all the time. And there's no way she's going to get that second hip replaced until we get to the backside of this. And she has to live with that pain every single day.
Thank you. Next question. Why are members of Congress going on vacation for 4 weeks in the middle of a public health crisis?
Right. My least favorite word in the English language is the district recess, which is how they usually relate to what we try to have everybody describe it as district work period. Look, all I can tell you is that since I've been home, I have been working from sun up to sundown. We have been on nonstop conference calls trying to get this big machine moved in the right direction. I talked to mayors and city managers, to public health officers. I talked to the state emergency management team, the federal agencies. I talked to the business community about what's happening to them. Every day is filled with these kinds of calls to create a feedback loop, both to input into what is the bill that we will vote on tomorrow and to begin to shape us for the next bill, but also to try to encourage the federal agencies to do the right thing. So I assure you as a matter of fact, I would put it bluntly. I've been in Congress almost 8 years. I've worked as hard in the last 2 weeks while at home as I have in that entire 8-year period of time, because this crisis demands it. And it's what should be expected of us, as a matter of fact. I also, thinking ahead to the next bill, want to tag on to something else Dr. Baird said. We didn't deal much in the bill that we're about to vote on for the precipitous decline in revenue for local and state government. Their revenues are going to fall off the table. I referenced talking to mayors and city managers earlier. The percentage of their budget that is dependent upon sales tax revenue is anywhere from 15 to 40%. And that's going to completely nosedive as a consequence of closing all the restaurants, all the retail shops. And they're going to have to accommodate that somehow. Historically, what's happened is that the federal government has stepped in as a partner to try to mitigate those impacts on them. In fact, there is something on the bill tomorrow, but it doesn't go anywhere near far enough to make sure that they don't have to cut vital services that compromise people's safety, as an example. And oh, by the way, yes, I am on the red eye tonight to go back to vote.
Along those lines, and the bill that you will be voting for, we had this question from Facebook, and we've also received constituent mail with similar questions. How can you vote for money for airlines that have bought back $46 billion of their stock since the Trump tax cut?
Yeah, it's a good question, and it's a fair question. As a matter of fact, you may recall, if you followed the news, that there was a Senate bill and then there was a House bill. The House bill didn't have that provision, but it is the nature of a democratic process and a two-chamber legislative branch that there must be compromise. And those provisions were in the Senate bill. The effort on the part of the House was to ensure that we learned and applied all the hard lessons of the 08, 09 Great Recession and what happened with that bailout, and the understandably held perception that we held harmless people that were a part of the problem. Well, in this case, I don't think anybody would argue that airlines are a part of the problem. But more importantly, here's what we insisted upon. First of all, that these be loans or loan guarantees for businesses. In the instances of airlines, there are some grants available, but they're hugely conditioned in ways that they were not in any way, shape, or form conditioned in 08, 09. For example, they only get the money if they keep their employees on and fully paid. Number two, they cannot do a stock buyback for the term of the assistance. Number three, their executive compensation is limited. Number four, they can't increase their dividends. So this is what we attempted to do, was significantly infuse into this worker protections, that we're not just bailing out the airlines for the sake of bailing out the airlines, but bailing out the airlines and the people that work for them. Now, finally, what I will say, and again, I hope I'm not being defensive. Again, this provision wasn't in the House bill, it was in the Senate bill, and we compromised these provisions. But I also don't think we want to wake up in a world where large numbers of airlines go bankrupt. And to be a little parochial about it, especially including our homegrown airline, Alaska Airlines, which is significantly at risk, as they all are. The coronavirus in this case was through no fault of their own. So if we are going to assist them to get past this period of time, then I think it's our responsibility to make sure they take care of their people and that we not, as taxpayers, be used. And I think those are the provisions. I think that will be accomplished with the provisions that we do have in the bill.
And so a follow-up question to that we received separately, are there strings attached then to these bailouts? What about for airlines, and then what about for Boeing specifically?
So for airlines, I've already described the conditions. Boeing was not specifically earmarked in the bill, but there is a provision of up to $17 billion for assistance to companies that are of a national security nature, and certainly as a defense contractor, Boeing would qualify under that. I think in this instance, and again, this is a, 1,400-page bill, and we're still reading it as we go. It's an incredibly in-depth bill. I'll say this, I probably haven't known as much about a bill of this size, and there are several along the way, the whole time I've been in Congress, but I'm still learning, and I'm still reading, and I'm still digesting. What I think the situation is with respect to the provision that might be made available to Boeing is those are loans or loan guarantees, and there's no cash grant per se, that federal government will recoup all its money. I would say about another pot of money, we're talking now about three pots. We talked about the airlines, we talked about Boeing. There's a bigger pot that is available for loans or loan guarantees to businesses, large businesses, state governments, and local governments on some basis, that also in the instances of businesses would enable the federal government to take an equity position. In other words, if you're going to borrow money from us, we're going to get what they call warrants. In other words, we get a piece of the pie. And I'm hopeful that the Treasury Department will administer it thusly.
Switching a bit to election security and making sure that the elections run, the next question is, what are you doing to make sure that the pandemic does not affect the 2020 election?
Well, this bill has $400 million in it for the Federal Election Assistance Commission, I think it's called, to help provide local governments and state governments with funds to make sure that their IT is hardened against any intrusion. Truth of the matter is, I think Congress is behind the curveball on this one, and that we haven't done enough soon enough to make sure that we can prevent that going into this election. But we did have $400 million in it. Going forward in what we hope will be the fourth bill, and we advocated for this in the House bill, which was not in the final version. We think that states, for the federal election portion, and Congress has jurisdiction over that, ought to go to vote by mail, as we have here in Washington State. It is more secure, and it is also a better way to avoid the spread of infectious disease i.e. avoiding having those long lines that go out and around the block in some states and in some communities with people in close proximity to one another. Several states, as you know, have delayed their primary elections, but I think it's important that we hold them. We have to figure out a way to do this safely. Vote by mail is a way to do it safely, by and large, because the fact of the matter is, in 244 years of our history, we have not once suspended an election regardless of the price. This is democracy, and in order to uphold it, we have to continue to practice it.
All right, and next question. This we received in constituent mail. I am a social worker at Western State Hospital. Governor Inslee declared my position essential, so I am unable to stay at home for a full 2 weeks. Does the stimulus provide real relief for frontline workers and their families?
Yes, but indirectly, and how it may or may not filter down to Western State, I cannot answer definitively. Another part of my continuing learning, but I feel for you. There have been patients at Western State who have been diagnosed, and those of you who work there are doing God's work on behalf of all of us in an especially perilous circumstance right now. I want you to know I'm very grateful, and I want you to know that I'm going to attempt to translate that gratitude into ensuring that you have the kinds of protections that would make you secure. I appreciate the question very much.
All right, and we're going to take a question from the Facebook Live comment feed right now. This is from Facebook viewer JW Foster. Denny, can you talk about how important it is for folks to use their relief checks to pay it forward by paying their bills and supporting local businesses as they reopen? I think you said it is one person's spending is another person's income.
Thank you, JW. For those of you who don't know, JW happens to be a friend of mine. He's the mayor of Yelm, and he's a Marine Corps veteran, among my favorite kind of people in the world. JW, thank you very much for your service to the community of Yelm and your past service. So one of the reasons why I so strongly advocated for an increased unemployment compensation benefit is that we know with a certainty that people, especially those of lesser means, spend all their money because they have to. And the magic thing about that is those dollars circulate through the economic system more powerfully than somebody who's given money on the upper end of the income scale. So that's the way that we keep this economy from getting even worse, is that we make sure that people can pay their bills. My wife and I, Paula and I, have been doing a lot of takeout, let me tell you, because we're attempting to help the local businesses, especially the restaurants, who are really being slammed by this, just unbelievably slammed by this. And for those of you who can, I hope you will do that. And when you get that assistance check, and by the way, I do get asked this question a bunch. Again, every adult below 75,000 or couple below 150,000, I think it is, will get $1,200 each and $500 for each child. And they should get that. Secretary of Treasury Mnuchin says about 3 weeks. We actually did this 10 years ago in the Great Recession. It took closer to 10 weeks. So I don't want to create hard and fast expectation because I frankly don't know, but the brackets are probably 3 to 10 weeks. And yes, the best thing you could do for the economy is to spend it, and to spend it locally. Thanks for the question, JW.
Next question. This is from Facebook. Came in on Facebook. I'm seeing a lot of posts about sanitizing groceries, but don't know the validity of their needs or process. Can you please elaborate on the need, and if so, best practice to clean our foods?
Well, the short answer is no, I can't, but I can talk a little bit about this. First of all, it's really important that when you shop, that you only shop for that which you need. There are obviously a number of people that are, I guess the term would be hoarding certain kinds of things, and that does no good to society as a whole. Take what you need. So make a list before you go. And when you come home, yes, it would be good to clean your produce. The FDA, however, has said that there's no evidence to indicate that the virus can be transmitted by groceries per se, but be prudent. And as always, wash your face or wash your hands many, many times a day.
Okay.
I could just add to that briefly. Yeah, from what I know about, and I think what we know medically about the sort of the chemistry, the chemical properties of the virus, it is rather hardy, but still susceptible to soap and water. So exactly, washing your hands is for the last several hundred years, honestly, has been one of the most important medical interventions that we have to prevent the spread of disease. So standard washing of your hands and your standard routine for that is, I think, what is being called for right now. I am no expert in produce, though, I would tell you, so I won't opine about that.
Thanks for that. Next question is about unemployment. What assistance exists for people who have lost their jobs? And how much of your salary will be covered by unemployment?
So the increase in unemployment compensation that is included in the bill we will vote on tomorrow, likely tomorrow, maybe Saturday, but I'm pretty sure it's tomorrow, is $600 per week. That's the increase above the current minimum. In addition to that, whereas the normal length of period of time for which someone would be eligible is 26 weeks, that's been expanded to 39 weeks. The $600 per week increase brings, as I recall, the average unemployment compensation benefit, and the underlying benefit is, I think, predicated on your income, to 100% of the state median. It is designed to be generous. It's also designed to be spent. As JW indicated earlier, what we are hoping is that people can pay all of their bills and make sure they stay current on their bills, not be damaged by this, and keep the economy going. Again, order takeout. I want to be real clear. The benefit is increased by $600 per week.
Thanks for that. Another question that we got through constituent mail.
Bobby?
Yes.
Maybe we should go back to the process here. If you have been unemployed, or if you are a part-time or what we call 1099 self-employed person, you are also newly eligible under another provision of the law. And the way to apply is just like anybody else who is a salaried employee or a regular 1040 employee who, not 1040, W-2, whatever it is, who's been laid off. You go to the unemployment office or go online and apply. And people ask me how long for that to take effect, how long before you can get your first check. Ordinarily, it's 3 weeks. I would say probably now a minimum of 3 weeks, given the system is being deluged by the huge number of applications. Sorry to interrupt, Bobby.
No worries. Thank you for that. The next question also comes to us from the mail, constituent mail. Where do you stand on Congress voting on legislation remotely? I'm worried that members of Congress will not be able to return to Washington, D.C. if there are travel restrictions in the future.
It's a good question. It's actually one that we're struggling with great difficulty, I might add. There is a sharp division of opinion within the ranks of members of Congress. The bottom line is, however, as it relates to what we're doing right now, that we cannot stand up a system to securely enable remote voting quickly enough. The fact of the matter is that our voting system is not connected to the internet. The fact of the matter is, to vote on some kind of an internet-based system would require outfitting every individual member with that capability in a way that is bulletproof, because that is absolutely not one system that you would ever want anybody to be able to hack. And we're just not going to be able to do it quickly enough. There's a lot for the people who would like to be able to vote remotely. They often say, we should have fixed this after 9/11, when we knew that there would be circumstances when it might not be possible for Congress to meet on a regular basis. But what we're doing now is members who can are returning. Not everybody is returning. If they're immunocompromised, they're not going back. If they're caring for a loved one, they're not going back. Enough members are going back, I believe, to take care of the business. And we're going to employ tactics that we have not before. We're going to vote in rotating shifts so that, I'm in group 6, the very prestigious group 6. And I don't know how many there are, but there are a lot. And we'll go in on a limited number of basis each and vote. During debates, and there will be a 2-hour debate on this bill tomorrow, after everybody is done speaking, the microphone will be wiped down. When we get to the voting part, and we vote in little machines in which we stick our voting card, those machines will be wiped down after every group. So we are utilizing some practices to minimize the exposure to one another. But on an ongoing basis, this is something that I think Congress is going to have to try and figure out for itself. And the truth of the matter is, I just don't know how yet.
Okay, and we're going to go to another question that came in from the comment section of this live feed from Facebook viewer Hannah Bennett. How can we help the veterans who are facing struggles?
Well, that's a question that I think is really worth asking, even when we're not in the midst of a COVID-19 crisis, as a matter of fact. I have the great privilege to represent the people of the 10th Congressional District in South Puget Sound, home to Joint Base Lewis McChord, the largest force projection base in the United States, and certainly in the Western United States. And as a consequence of the high livability quotient for this region, requests to serve at JBLM are higher than any other posting in the Army. And as a consequence of how people enjoy that service while they are here, they retire here. So the 10th Congressional District has the 4th or 5th highest number of veterans of any congressional district in America. So this is something that is on my mind, irrespective of the COVID-19 crisis. Now, as it relates to that, however, the big bill we're voting on tomorrow has, I think, about 14 or 15 billion dollars to supercharge the veterans' health system to make sure their healthcare professionals get PPE, to make sure they have sufficient personnel to deal with the veterans, and to make sure the VA hospitals, of which there is one in the 10th Congressional District, are sufficiently staffed and outfitted so that they can care for the veterans. I don't think this is a question just for the virus period of time. I think we could do a lot better by our veterans day in and day out.
Okay, and moving on to the next question. I've heard different predictions about how bad this outbreak is going to be. What should we expect in the coming weeks?
Dr. Baird, do you want to take a whack at that? I know you're not an epidemiologist, but I do think you can, again, talk about the curve and the trajectory and what is necessary for us to do as well as we can.
Sure, I'm happy to do that. I'm going to look on my computer here to get the website for folks to look at. So the Institute for Health Metrics and Evaluation, IHME, here at the University of Washington, has a great website they just came out with today. The link is covid19.healthdata.org, and they have projections as to what the curves are going to look like. And so we really do think, using the best data, a few things. Number one, there's a lot of uncertainty. One of the things that I've learned certainly in the last 2 or 3 weeks is that what's going to happen tomorrow is a real good question. So there's a lot of uncertainty, but within uncertainty boundaries, we have a good idea of what the sort of the average prediction is. And it looks like state to state, there's going to be some difference. Washington is a little bit ahead of cases than other states are, and some places like New York are particularly more dire right now. But it looks like in the next few weeks, next couple weeks, it looks like things are going to spike in terms of the number of new cases and unfortunately deaths. And that's also what we're gearing up for in terms of hospital patients, those needing more acute medical care, needing more testing, et cetera. So it looks like sometime in the next week to 3 weeks, we're looking at spikes of the peak. And then there will also be a drop down over a period of weeks. And so we can expect the situation that we have today to be increasing in acuity for at least a few weeks, and then to even get back to the level of acuity we're at right now, take a few weeks too. So this is going to be a many week process where I do not think by the first or second week in April we'll be done with any of the need for the isolation and the preparations that we're doing right now. I think we'll actually, far from being able to be out of those things, I think we'll be reaching the peak at those times. And we will probably need several more weeks of attention to this too. So that's what the trajectory looks like. And the projections are also, in a medical sense, depending on state to state and community to community, looking like our medical system will either be able to bear the brunt with really just some going a bit over our capacity, all the way to, in some places, going perhaps and unfortunately extremely well above what our capacity is to care for individuals too. So however, I have to say there's a lot of uncertainty. And so while you can look at those projections on that website, as I said, those are the best information that really exists, I believe, on the planet in terms of projections, but they are projections, and all of the projections have a line of the average, but then they have uncertainty around those lines. And the uncertainty means it's probably going to be within that band, but we don't really know exactly how bad it's going to be. All I think that we can tell is it is still increasing in severity, will do so for a matter of weeks, and then will continue to be recovering, but still rather acute for a matter of weeks after that.
And Dr. Baird, did you, we are doing this teletown hall, or this digital town hall right now. Obviously, we're all taking steps to be socially distancing. How has this affected your field? And in terms of telemedicine, in terms of what you are seeing?
So yeah, with regards to especially what Congressman Heck was saying about voting remotely, we're having to do a lot of medical visits remotely too, and that's something that thankfully we are rather prepared for in some settings. And so if you end up coming down with symptoms and end up having to contact your provider, it is actually not unlikely that you may be asked to have a telemedicine visit so that someone can ask you about your symptoms remotely at that point. That is one of the safest ways to do the assessment, to then decide whether or not you may need a test. But one of the things that is very very heavily weighted in my mind is that the employees that we have in medicine and in the laboratory are essential employees, and we do have to work sometimes at close quarters to continue to care for people. And most of the actual processing and testing work cannot be done remotely. And so just like Congressman Heck was saying, there are still some jobs that require us to be there in person. And so we need to be aware of that.
Okay, we have time for one more question. And this one comes from Lily Mahoney. She said, Denny, I am concerned about my fellow postal employees. The postmaster has been having trouble trying to supply hand sanitizer and gloves to its carriers and window clerks. Is there any way you can help prioritize the supply of our federal and postal employees who are deemed essential personnel?
Oh, unfortunately, that was a provision that was in the House bill that did not survive the negotiations with the Senate. Look, there isn't the money in the bill that we're voting on tomorrow directly to do this, but I want you to know that there are a lot of people very mindful of this as we look forward to the second bill. As a matter of fact, not only do I think it's the right thing to do to ensure that the people that are in these circumstances have the right personal protective equipment, but we should also remember that the Postal Service is heading toward bankruptcy, and it's been impacted by the COVID crisis as well, but its role is even more important. Think about it. This is the way now people get so many of their drugs, is they order them online and they come through the mail, as an example. This is what enables people to order things online so that they don't have to go out right now and be around other people and increase their risk of exposure, as all those retail places are closed often anyway. So I think we've got two jobs to do. I think we need to provide the resources to make sure that you have the PPE, as we call it, but I also think we need to make sure that the Postal Service is healthy.
Okay, that was the last question we have time
Bobby?
for.
Bobby?
Yes.
Is there any way, are we done with questions? Could we go a little bit
We could
longer?
we could go a little bit longer.
Dr. Baird, are you able to stay a few more minutes?
Sure.
Thank you.
Okay. One of the actually, this is a fairly straightforward question. Do I still have to go out and get a real ID?
Oh, the scheduled real ID deadline was I think October 1st or October 31st of this year. It's been extended a year. So if you've been sweating getting in there and I tried to do this one time and I forgot the right document. If you've been sweating getting into the Department of Licensing with all your documentation so that maybe someday when restrictions are lifted, you can travel to and from Vancouver, Canada, you don't need to worry about it for a year. They've punted it for a year.
Okay. And next question, how will the stimulus package affect educational institutions, both from K to 12 and colleges and universities?
So I can give you the top lines. There's about 30 billion in there, split almost evenly between K-12 and higher ed. A lot of the K-12 language that I've read has to do with you're eligible for this money when you show that you've had COVID-19 driven cost. The higher education thing has to do with that kind of thing as well. That is support directly to institutions of higher learning. Interestingly, however, we also put a hold on federal student loans. So if you have a federal student loan, if this bill passes, again, it's in this bill, don't do this yet, you are given payment holiday until the end of September of this year. You don't have to worry about it. Your interest does not accrue. You just pretend like you pulled these 4 or 5 months out of the calendar and it doesn't matter, but come September, you need to resume payments, assuming that we get on the backside of this thing and don't be delinquent then. But for the time being, federally issued student loans are held in abeyance.
For the next question, you touched on this earlier a bit when talking about veterans, but where do those stationed at JBLM go if they have questions?
They've got a website and a hotline, and I recommend people go to the Jblm Hotline. Lieutenant General George, who's the new commander of First Corps, holds regular town halls, teletown halls like this one to get out information. They have gone to HP Con Charlie, I think. This is one of those ranks of limitations of movement and activity on base. One of the conference calls I've had a couple of times is with the Joint Base leadership. Talked to both General George and also with Colonel Duncan, who is the garrison commander, Joint Base commander, a couple of times about what measures they're adopting in order to assure the safety of the service members and the civilian employees. I think I won't say most, many of the civilian employees are teleworking. They've closed all events down and adopted a number of other measures. We're tentatively scheduled to have another conference call with them next week. But in the meantime, I recommend you go to the website.
Okay, next question. This is a broad one that I think could be for both of you. How do I help my community right now?
Dr. Baird.
So one of the things I would say that's actually we talk about it in the medical field a lot, but it's every bit as important right now. Giving blood. Guess where we get a lot of our blood? We get it from high schools, blood drives. So healthy 18-year-olds are really help us out, and they're not at school right now, and so blood drives have been largely canceled. And again, while COVID itself doesn't require blood transfusions routinely, all the other things that still keep happening in the hospital system do happen, and we are getting critically short of certain types of blood products and blood types all around the country, not just in the state of Washington and UW Medicine. So giving blood really, really, really helps, and you will save the life of someone. I think if I had one thing to say right now, that's probably the best thing that every single person could do today if they have the ability to donate blood and they meet the screening requirements for doing that. And then the other thing I would say that's, not everyone, I've been flooded with so many well-meaning offers to help in every just way. And, I have to say, no, not everyone can do laboratory testing. I'm sorry. But I wish they all could, because we need a lot of folks, but we need, folks who have the training and licensure to do that. But we have been so blessed to have all of our local restaurants come and give food in the midnight and the evening shifts, the workers, because people are working 18 hours straight to do these, to get all these tests processed and run. And we've had so much generosity from our community to do that for that. So really, paying forward, being kind to one another really does help. But going back to what I said about flattening the curve, really do take all of the recommendations of our medical professionals and our CDC and our public health seriously, and do the social distancing, do stay at home, do not congregate in groups, follow all those recommendations, because they will likely help you with your own health, but almost certainly help the rest of your community, and the most vulnerable among us stay alive. Not just maybe not get the sniffles, but actually you'll be saving lives by following all of those rules. They are there for a reason. Congressman Heck?
I think you said it exceedingly well, Dr. Baird. The only thing I would add, because I do think you said it very well, I have been recently made aware that our local food banks, who are also getting slammed, are really suffering from a decline in volunteers, because historically an awful lot of the volunteers that help food banks are older people, retirees, and they are, of course, in the more risky demographic. And so out of an abundance of caution, many of them have chosen to stay home, and that's prudent on their part. But for those who are not in one of the risk categories, your local food bank needs you now. They are getting jammed like they haven't been jammed in 10 years. And keeping up with the demand requires people who are willing to step forward and volunteer. And if you can, I would recommend it.
I should have said that too. I would only second what you just said. Helping, nourishment is nourishment, and the folks who are the neediest among us, they still need all the help. So any donations or time that could be directed towards food banks, I am especially supportive of our local food banks too. I really do think that's important.
Next
Bobby,
question.
one more?
Sure, we can do one more. The next question is, what was the difference between the House bill that was being talked about, and then did you have legislation in that bill, and what has passed in the Senate?
Well, it's called the CARES Act, Coronavirus Assistant Relief Economy. I don't remember what we insist on creating these acronyms to name legislation, but the bill has passed the Senate. It's $2.2 trillion, just to put a number on it, and it will be voted on in the House tomorrow. The bill that did pass the Senate was negotiated between the Minority Leader, Senator Schumer, and the Majority Leader, Mr. McConnell, but including involvement by House members, both Speaker Pelosi and Minority Leader McCarthy, and the administration was represented by Secretary of Treasury Mnuchin. And so the bill that passed the Senate is the agreed upon compromise. And the bill that was introduced into the House was higher. It was $2.5 trillion and included some things not included in the final bill. For example, I had advocated strongly for a rental assistance program, which there is some money in there, but it's not very much, frankly. It's pretty de minimis. We'll keep it in mind for the fourth bill. And there are some things in there that weren't in the House bill. Again, the legislative process is one of compromise. But again, the things that I fought most hard for were the unemployment compensation increase, getting the money into the hands of people who need it the most, and the assistance to small businesses, because the fact of the matter is, if we don't come in here with a Marshall Plan type size program, we're going to lose a bunch of these small businesses and they won't be able to come back. And that means that the jobs that they countenance won't come back with them as well. And then thirdly, of course, our the infusion of dollars on the public health front. Again, the single most important and effective thing we can do to keep the economy from going any deeper is to get out ahead of this, to flatten the curve, as Dr. Baird says, and to make sure that we're on top of this. By the way, not to end on a negative note, but I did want to go back to something Dr. Baird was talking about in answer to the question about the projection and his reference to charts that indicate that sometime into mid-April we're going to hit the peak. I think we're going to hit a system fail. Now, again, I'm not an epidemiologist, but I can read numbers. And my definition of a system fail is that we're going to be beyond, for example, bed capacity, ICU bed capacity, and we're going to have to adapt the best way we can and surge the best way we can. But that's what we're headed for, in my opinion, in all likelihood. And the only way to have a prayer of avoiding it is to follow the recommendations about social distancing and staying at home and washing your hands a lot and the like. The only way that we can keep it from getting any worse is to follow those recommendations. I'm confident we can do this because, as I said at the outset, we've risen to a lot of challenges before. We have to stay positive. We have to take care of ourselves. We have to be mindful of our neighbors. If you've got an older person in your neighborhood for whom you can maybe get their groceries and prevent them from having to go out and getting exposed or the like, somebody, again, who's immunocompromised, do that. Take care of one another. Be determined to defeat this because I think we can. And again, as I said at the outset, don't give in to fear. Answer our better angels. And part of answering our better angels, I think, is expressing our gratitude. So let me end with that note. Thank you for joining us in this conversation. And very, very especially, I want to thank Dr. Baird. Again, this is a state treasure, if not a national treasure of expertise, and he certainly demonstrated that this evening. So Dr. Baird, Geoff, if you will, thank you so much for being a part of this conversation.
And thank you very much for having me. I always try to also end exactly on the same note with many thanks. And I'd like to just say thank you to the team at University of Washington, Department of Lab Medicine and the Virology Lab especially, who've made it all possible for me to be able to help the state and the region. So, and thanks for inviting me to participate in this.
You're welcome.
Okay, that is the end of this live feed. Thank you both. Thank you, Congressman Heck. Thank you, Dr. Baird. And thank you, everyone, for watching.